Okay, everyone. This is Joe Zebach from Luma Health. Thank you so much for joining our customer-led webinar here. As you've seen in the emails, we've got something pretty exciting to show you. We know the Luma Health platform is pretty powerful, and we offer scheduling and quite a few ways to attract patients and get that schedule full. And today we want to talk through a workflow that Greg from Optima Derm helped co-design, and it was so cool. We figured we'd do a whole webinar about it and invite folks and share the goodness. And so I'll jump right into it. The format today is pretty nice. It's interactive, right? So a quick, to the point, 20-minute presentation followed by any Q&A that you might have. We've got some team members here from Luma that can help field up and prop up these questions. So yeah, get ready to be engaged. Hopefully the content is as awesome as I know it is. And we'll jump forward with some introductions here. Of course, as I said, I'm Joe Zebach. We also have Ryan here from the Luma Health team, Luis from the Luma Health, and of course, Greg. Greg, if you'd like to kick us off with a quick little intro of who you are, your role, and we'll get this thing started.
My pleasure. Yeah, Joe, thanks for letting me participate. So hello, everyone. Greg Traquair, Chief Technology Officer for Optima Dermatology and Medical Aesthetics. Do you want to go to the next slide here, and I can give a quick intro on who we are? So real quick, before we dive into talking a little bit about the solution we co-developed with Luma. So we're at Optima focused on the dermatology and medical aesthetics space. So we do traditional general dermatology, skin cancer surgery, pathology, we do clinical research, and then a bunch of different services within the cosmetics line. We've got roughly 15 locations currently across Indiana, Ohio, New Hampshire, and Maine. And our mission is really to provide great access to all these services in many of the markets in broader New England that need them. Awesome. So a little bit of context here as we dig into talking about self-scheduling and the solution stack that we built in partnership with Luma. But good to just start with, why self-scheduling and what were the business objectives for us as we launched into this project. So the first one was increasing volume. We're a de novo based, organization. So we're opening new clinics in new markets that need access to dermatology and the other services I shared earlier. And one of our primary objectives just universally is to get these clinics busy as quickly as we can and start serving patients in these markets. And so for us, we did see self-scheduling as a potentially really powerful lever to drive patient volume into these clinics, particularly when we think about the 24/7 nature or just the convenience factor of it. So our hypothesis was that there's people out there that wanted to schedule appointments at all hours of the night, which ended up being true, and we can talk a little bit about that as we get into kind of the post-implementation piece, but that was certainly one of the primary objectives. Second to that, and hit on this a little bit with the convenience factor, but in this day and age, not just in healthcare, but when we look about customer experience, in our case patient experience, we really want to raise the bar, and we want to meet the level of customer experience that's being set by other industries that are really leading the way. So, other commerce, retail, things of that nature where we think about truly white glove experience. And so as we thought about that, we thought, okay, well, self-service, digital channels are sort of, table stakes at this point. We want to make sure that is 100% available to our patients and seamless. So if they want to book an appointment with us at midnight or just happen to be in a meeting that's not very engaging and want to get in their cosmetic appointment, that's available to them. They can do it on mobile, they can do it web, they can do it all the various channels. Cost reduction is the third one. So while we love providing that, team member based, phone experience for patients who are calling in, certainly it's one of the most expensive treatments we have available to us. And again, we lean into that, and we cherish the team members that serve our patients over the phone. But for folks who would prefer to and would rather self-schedule, we also see a lot of opportunity to reduce costs to help us just manage the footprint of the team members that are answering those inbound calls for scheduling, rescheduling, and things of that nature. And then this last one is less of an outcome-based goal, but more of an enabling goal. And it really comes down to, we knew getting into this, said this was self-scheduling as a new capability for us. There was a number of other attributes that we wanted to achieve as a part of doing this. And so one of our qualifying objectives for determining what solution we wanted to use was, let's make sure that as we roll this out, we're going to learn a whole bunch about who's using this, how they're using it, and we want to make sure that the solution stack that we're using can adapt with those learnings. So are we going to be able to be agile? Are we going to be able to make modifications, enhancements, and optimize how we're doing things to drive all three of those business-oriented outcomes? All right, Joe, you want to go to the next slide for me here? Awesome. So with that said, good segue into the solution stack. So working top to bottom here, we're very fortunate to have a quite talented marketing team here at the Optima organization. And so they're doing all sorts of their own optimization work to drive visitors' eyeballs across all of our various digital channels. And so that could be social media, that could be search advertising, that could be just SEO on our website. And so, you know, a big part of our assumption around kind of this whole self-scheduling life cycle is making it seamless and making this self-scheduling experience available to our patients at those digital channels where they're interacting with us. In the middle, we've got Luma Health, who we've been, you know, heavily using across our sort of entire patient engagement sort of suite of capabilities. So, you know, this was obviously something that was already in our tech stack, but not necessarily deployed yet for self-scheduling purposes. And then we're also, our EMR practice management system is Modernizing Medicine, and we utilize Salesforce.com as our CRM, which, like Luma, is really something that we use to wrap around ModMed and help us extend the capabilities of our core EMR and practice management system. So that was the sort of core tech stack that we started with and decided that we wanted to launch with for self-scheduling. But the big missing piece, you know, in our opinion, as we looked at the business requirements and what ideal state looked like for us for self-scheduling, we were missing some of that communication between systems. So that last bullet at the bottom, Luma Health, Salesforce, and Modernizing Medicine, you know, one of the kind of key gaps that we identified was just making sure that we harmonized all three of these platforms in service to a really remarkable end-to-end self-scheduling capability. And so that's where we engaged the Luma team. Many of the folks were on the phone, and I think they'll talk a little bit about what they helped us come up with.
Yes, definitely. Thank you, Greg. And I will hand this off to Ryan in just a moment. But you know, when customers come to us with some interesting needs, in this case, keeping that schedule full and having a more even more effective scheduling process, right? Because we're driving traffic to these forms and bringing people back. It spurred a conversation that turned into what we call a LUMAKIT, which is really us working with our customers to co-design use cases and then sharing that with the rest of our customer base. So this one is called the Salesforce Connect LUMAKIT. And it is really all about taking those Luma forms that you already have. In this case, in this webinar, we're focusing on a scheduling form, but it could be a health screening or risk assessment or a survey of some sort, and sending that into the CRM. So Ryan, I want to open it up to you to expand a little bit on how this LUMAKIT actually works, and then we'll jump right back into the meat of the content for how this Recapture workflow works for Greg and his team.
Yeah, perfect. Thanks, Greg. Thanks, Greg and Joe. So like Joe said, we take data. It can be from any Luma form. So Luma has a powerful form capabilities where you can customize forms. So they can be your standard forms, they could be unique forms, could be scheduling forms, could be intake forms, a lot of different workflows around the type of forms we can support. And so any of these forms, different kinds of forms, can be linked to this LUMAKIT. And in this case, it's really powerful because we're driving a bunch of traffic to the start of these forms, and these forms will have a list of questions. In Optima Derm's case, it's a scheduling form, so we're asking for the patient's information, we're trying to figure out who they are, some of those types of things. And so as a patient flows through different form questions, Luma is taking that data and putting it back into Salesforce as a lead. And so as the form is completed and at each step along the way, the patient fills out a different question, another question, Luma will update that lead with more and more information. So what is essentially happening is that we are creating something from scratch, adding more and more information to it as the patient kind of flows through the form. And so that Salesforce lead will now have the most up-to-date information from when a patient started. We get the initial capture of the information that they give us, in this case, the patient information. So we'll put that into Salesforce. They answer a question maybe about their history. We'll put that into Salesforce. Maybe they answer something else about the appointment type that they would like to come in for. We'll put that back into Salesforce. So all of this information that is coming into Luma will be transferred over into Salesforce for Greg and his team. So again, the workflow from start to finish is a patient will land on our Luma form, and then we'll eventually end up with a completed form or an incomplete form, but Salesforce will have all of that data right there at their fingertips for Optima Derm's team to follow up on.
Thank you, Ryan. So let's jump into specifically the use case of this LUMAKIT for Optima Derm that Greg and his team co-developed with us. Greg, take it away.
Awesome, thanks guys. So yeah, so for us, again, to dive into some of the scenarios here, the happy path scenario is, our marketing team is doing a great job engaging potential patients of ours via, again, all those various web and social channels. We're then, using those clicks to drive people to the self-scheduling experience. And ideally, they're making it through step 1, 2, 3, 4, all the way through that, self-scheduling capability where they're booking an appointment for themselves with the provider that's appropriate for them, at the location that's appropriate for them, for the appropriate service. And that's getting then synchronized into modernizing medicine. It's booking the appointment in our practice management system. But as Ryan noted, it's also then capturing all of that data in our CRM as well. So just in that use case, that's a home run for us that, and in our case, we have validated and seen this. We have patients that do indeed want to schedule appointments at midnight, and which, is fantastic. And so it's fantastic that we can now make that available to them. And so mission accomplished, that they could go to our website, click schedule now, walk through this process and end up with an appointment reminder coming to their phone. And then not only that, we've seeded our CRM with all this great data that we can use to continue to drive marketing communications and just that whole relationship with them from a life cycle perspective. So that was obviously a fundamental use case and kind of the core happy path use case. That said, one use case that was really important to us, and we had to emphasize this with the Luma team as we were going through this, was we knew that there was going to be some percentage of people that were not going to make it all the way through for whatever reason. And that's true for really any complex form, that you build on the web. It doesn't matter how user-friendly you make it. In the case of Luma, I mean, it's extraordinarily user-friendly. But we've found from patients talking to them, that, they didn't have their insurance card handy, or they started to do it, but, just decided they got distracted for whatever reason. And so for us, it was important that all that work that the marketing team had done to drive people to that call to action, particularly during business hours when that call to action could have been a phone call into one of our team members. If we're going to drive them into that self-scheduling experience, we want to make sure if they don't make it all the way through, A, we've captured that data about them, and B, it makes it really easy for us to follow up. And so that's exactly what this has enabled us to do, where if someone comes in, they fill out step 1, which is just basic demographic information, hey, first name, last name, phone number, email, next. And then they realize, oh, this is a self-scheduling, as an example. I thought this was maybe just a request form, and they leave. That doesn't mean a lost opportunity for us. That means one of our team members can give them a quick call back and say, hey, we saw that you had started the process of self-scheduling. We just wanted to make sure that we could support you if you were interested in getting an appointment with one of our providers. And what we found is, 100% that does happen. And we've had a lot of success calling back and communicating back with these patients. And we hear a whole variety of different reasons for why they didn't finish the form. Again, it's that example I just gave of, I thought it was a request form, and I made it past the first step and realized it was going to be 2 or more steps. And so I was, kind of done, not the right time. Totally cool. Is this a good time? Yeah, this is great. And we get them scheduled. Alternatively, we've had people that maybe make it to the insurance information, or they make it to a step and they're just uncertain as we're asking some of the questions about our services for cosmetic, for example, and they really want to talk to someone about, service A versus service B. And again, that allows us to activate that white glove, team member experience where we're going to call them, we'll get them on the phone, we'll advise them and get them scheduled accordingly. And I think for our experience today, we've only launched this in beta so far. So we've launched it on a series of beta landing pages and for a couple of our temporary spaces. But during that beta period, we've been extraordinarily pleased with not only A, how many people make it through the whole process, but B, for those who do end up dropping at step 1 through 4, how many of those folks are thrilled to get a call back and then are interested in resolving whatever question or issue they had and getting it scheduled. And then lastly, all that data that we're capturing along the way, going back to some of the original goals, as we're gathering that data and seeing at what pages are people leaving us, and then as we connect with these folks and inquire with them, hey, what did you think of the self-scheduling experience? Why didn't you go through the whole process? We're using both of those feedback loops to help us continue to optimize those forms in partnership with Luma. Our goal being to get as many people through that process end to end as possible. And then for whatever percentage do end up not completing it, we're right there with the data to then, follow up with them and serve them as best we can, and ideally get them scheduled to see one of our providers. And with that, I think that's pretty much an overview recap of our use case. So I think Joe and team, back to you guys.
Yeah, wow, that's awesome, Greg. Thank you so much. And then that kind of wraps up the presentation portion of the webinar. But as we said at the beginning, we want this to be as interactive as possible. And so I just wanted to open it up for questions and answers. And so if you have one, feel free to put it in the chat, and then the Luma team will pick those up. I wanted to start with one, Greg, specifically. You mentioned in beta, is there any like preliminary results you could share? And I know it's or preliminary results and what it might look like to continue to optimize this as time goes on.
Yeah, I would say, sort of phase 1 with, limited optimization and just in beta, but we've seen, over 30% of those folks who are falling off of that happy path, who are pleased to get, us to follow up with them and get an appointment booked. So, to the title of this slide, the lead recapture, 100% we're seeing, even in just version 1 of this as a beta, a pretty significant percentage of those patients that fell off who are recaptured and put back on the happy path. We're going to be transitioning out of beta and getting this onto our website more fully launched in May. And so we're really looking forward to that and continuing to tune the form, see a lot more traffic ideally, and continue that continuous learning process.
Nice. We've got a question from a representative of PHVC. Ryan, I think this is actually a great one for you. The question is, does this only work with self-scheduling form, or can this also work with a custom form?
Great question. It can work with any type of Luma form. So this can be a custom form. It could be a appointment request form, like you asked in the question. It could also be an intake form and some of those other kind of other forms that we have built in Luma. So any unique form that you have in Luma, we can connect these two things together.
Excellent. And if you have any questions in the audience, feel free to drop them in. Another question around Salesforce, right? So obviously this workflow is with the Salesforce CRM. Is this implementable with other CRMs that any customers might be using? Maybe Ryan, you could take that one as well.
Yeah, I can take that one. So the short of it is all of these connection pieces are in place to kind of grow this CRM base outside of Salesforce. Obviously, Salesforce is the one that Greg and Optima Derm and team are using. But yeah, this architecture can be extended past just Salesforce. So other CRMs that are out there, anything that you guys are currently using, absolutely.
Perfect. One of the curiosities, Greg, that we have around just the job of the CRM. I've just noticed in reading and paying attention to the industry that CRMs are rising in their usage in healthcare specific applications. Can you compare and contrast a little bit to the job of the CRM to your EHR ModMed and what one is doing that the other might not be?
Absolutely. Yeah. So for us, I've got a lot of my experience, prior to Optima Dermatology, was doing a lot of work, in the CRM space, helping organizations in healthcare and outside as well. And admittedly, my personal 2 cents here is that EHRs, practice management systems, are not really all that great at CRM-related capabilities. So when we think about tracking the interactions between the customer, in our case, the patient, and the organization, we want to be able to have that, the term gets overused, but 360-degree view of all of those interactions we've had, whether it be by phone, SMS, that visits, et cetera. And so for us, we're using Salesforce in that traditional capacity. We've got, a team in our patient services center that's answering calls from patients to do scheduling and things of that nature. They're handling inbound referrals. They're handling, again, these self-scheduling inquiries that are coming in that maybe aren't finishing, appointment requests. So there's a number of touch points that patients are having with us that funnel into our CRM and then facilitate further interaction, and then we're tracking that interaction. And so in addition to that, we're also synchronizing a fair bit of our kind of interaction-related EMR data in there as well. So appointments is coming in, patient data is coming in. And so it truly is that place where we have that 360-degree view of the patient and all the touch points beyond just the appointment in a much more coherent fashion. So I'd say out of the box, Salesforce or any CRM is probably going to, do a better job than many of the EMRs out there at just that one core activity. In addition to that, and one of the reasons why we selected Salesforce is that it's also just a tremendous low-code, no-code development platform. So for us, we also want to be able to, again, create systems that are going to drive workflows to create a remarkable experience for our staff and for our patients. And so we've also used it to plug a bunch of different holes, operationally speaking, that the EMR just does not do well.
That's a great, and I think Lynn has a follow-up question here. Is this set up with Salesforce Marketing Cloud or Salesforce Health Cloud? And then maybe after Greg takes the first half of that, Ryan should be able to do either, right? Go ahead, Greg.
Yep. Yeah, absolutely. So we're again, heavy Salesforce users. So we've adopted the Health Cloud data model. We're using their kind of full suite: Sales Cloud, Service Cloud, Health Cloud, and then we also use Salesforce's Marketing Cloud. My impression is that it seems like this LUMAKIT would work with any and one or all. As much of that really just drives how much of the Salesforce features are available to you and aspects of the data model. But I'll also tag in Ryan here to comment further if helpful.
Yeah. So it's a great question. So speaking specifically about Salesforce, right now we're creating leads in Salesforce. So this could be in any version of Salesforce. We can actually create contacts. We can create in whatever Salesforce instance you're using. We can create multiple different objects, types, whatever is most helpful for in your workflow. So in this case, for Greg and his team, we're creating leads.
Awesome, thank you. Neil asked a question in chat about if the LUMAKIT is a separate product available for purchase. Yes, it is. And if you are interested, you can follow up with me, my personal email, your customer success representative, or your account executive. And then also Neil just put in, does this work with custom objects in SF? I think that would be a good answer, Greg, to touch on that. And then I had a follow-up to that as well. Just a little bit more color on the experience for the agent on the other side. I know you touched on it earlier, but if you could kind of dovetail the custom objects to that.
Yeah, so Neil, we are using custom objects as well as a part of our integration with Luma Health in this scenario. So yes, it does.
Excellent. Yeah. Looks like we have.
Well, Joe, did you?
Yes. Sorry, Greg. Thanks for reminding me. Yeah, I was curious in the call center agent flow. Essentially, the Salesforce Connect is creating a queue that the agents then work. Do they just sign in to Salesforce, or what does that experience actually look like for them?
Yeah, absolutely. So for anyone that's familiar with Salesforce on the call, you've got a number of what they call objects, which are just your different data tables. They have tabs, within the list. And when you go to those, they have a feature called list views. And so really this is just a capability for managing work and work that's open, that's assigned to different people. And so in our case, we've got a number of different queues. And in this case, we've got self-scheduling queues that are showing us new self-scheduling inquiries that have come in, ones that maybe we've attempted a follow-up but have not reached them. So a number of ways where we can kind of slice and dice this. And so for any individual agent, it's easy for them to see that queue of open self-scheduling inquiries that came in where the patient didn't fully book. We've also used formula fields in Salesforce to help us create service level flags. So if we've gone too long without actually making an attempt to get in touch with this patient, we've got different alerts and triggers that let us know, hey, it's been a little too long, before we've tried following up with this person.
Nice. Changing gears a little bit. I'm curious about this one. There's a question from Gandus, I believe, around what makes investing in a CRM like Salesforce really worth it, just from a customer kind of lifetime value. Curiosity there. I know you have a lot of experience with Salesforce prior to Optima, Greg.
Yeah, I mean, from our perspective, we truly want to provide a remarkable patient experience. We've augmented a lot of our clinic staff with our patient services team, who is an extension of our clinics that handle a lot of the inbound and outbound phone activity in particular. And so we want to, again, provide that platform for them where they've got a single pane of glass. They can see really everything about that patient, all of the web activity, the inquiries that they've put in, the past appointments that they've had, how they've engaged with our marketing materials, so that we can engage that person, as our mission statement says, like friends or family. So that's really the goal for us, is we want to provide those agents with as much information for them to have a truly remarkable and patient-oriented conversation as possible. We want to empower them. And then in addition to that, again, we're just big fans of the added bonus of just how extensible Salesforce is as a platform. I can't speak to, others' EMRs, but I can speak to mine and say it's not a platform that we can do a lot of customization and extension of, whereas a platform like Salesforce provides us almost infinite capability to continue to extend and optimize the platform. And so that just helps all of our various team members who are serving patients in various different ways. We can create systems for them that are extension of that 360 view to enable those other processes that we just can't do well with our EMR. Yep. And for us, when you kind of add up, the logic of, all of those different things, to us, the ROI is clear there. That in the absence of that, spreadsheets or trying to force the EMR to do some of these things, just doesn't come close to driving the business value that we've had, leveraging a platform like this.
That's a great answer. Yeah. I mean, the best companion for a system of record is a system of action like Luma and Salesforce. Here's a question from Caroline. Does Salesforce integrate with Optima's phone system to auto-log calls from patients as they come in and go? Or is this data logged manually in Salesforce at the patient level?
So we use a platform called Five9 for our phone system. And so Five9 and Salesforce, work very seamlessly together, and which was one of the reasons why we chose Five9 as our phone vendor.
Okay, question from Lynn here. Once Optima implements this, is your patient communication coming from Salesforce or Luma?
So we're still using Luma Health for, all of the core communications that does really well. So we're doing patient reminders, we're doing the post-visit, communications, we're doing the feedback with the Net Promoter Score and the surveys. So a lot of those kind of transactional visit-oriented communications, we're still using that out-of-the-box Luma functionality. The CRM is really driving predominantly a lot of that voice-based communication. So as we think about team members across the organization who are interacting by phone with our patients, they're using that. And then we're also, because we're using Marketing Cloud, as we think about nurture and sort of longer marketing-oriented journey-based communications, that is also driven by Salesforce. But so we've got both. We've got communications that are coming from Salesforce, again, predominantly phone and some of those more kind of longer term life cycle communications from marketing. And then Luma is still, the system for us that's driving a lot of those visit-based transactional communications.
Excellent. All right, looks like we got another question from Neil. Love the interactivity, Neil. Does Optima integrate with your EMR with Salesforce directly or only through Luma? Does Salesforce integrate with your EMR outside of mutually exclusive of Luma?
We do have some interoperability there. The biggest piece is we have a nightly feed that we're using to synchronize data. We're hoping that our EMR makes their APIs more robust so that we could do more integration between Salesforce and our EMR. Right now, we're a little bit constrained just by the APIs that are available with our EMR. We leverage what we can. But fortunately, and we also piggyback on what's already done by Luma. So, if there's already interoperability there, for example, for self-scheduling, we don't need to do, the appointment booking process, between Salesforce and ModMed as an example, because Luma already facilitates that process of creating patients, creating the appointment quite well. So what we're more interested is just, again, synchronizing data in areas where Luma isn't necessarily covering it for us. And some of that, is leveraging APIs if they're available. A lot of it is more just, daily data synchronization to make sure we've got that full picture of our patients.
Awesome. Thank you, Greg. Okay, well, I think that about wraps everything up. We've answered all the questions. Greg, I want to say thank you again for spending some time with us. And please just go back to the sun of North Carolina. Thanks for taking a slice out of your day. Luis, Ryan, thank you for joining. And yeah, we will follow up with this recording in case there's something that was particularly juicy. But until next time, have a great day, all. Be safe.
Thanks, everyone. Appreciate it.